The 10 metformin side effects your doctor is praying you don't discover. This single pill is prescribed over 86 million times every year in the United States alone. It's the number one weapon doctors use to fight high blood sugar. But what if that weapon has friendly fire? What if the people prescribing it are quietly hoping you only read the first 2 lines of the warning label? Look, metformin is hailed as the gold standard for type 2 diabetes and prediabetes. For decades, it's been the go-to first line of defense drug to lower A1C and manage insulin resistance. Your doctor likely presented it as a safe, effective, and non-negotiable part of your health plan. And for lowering blood sugar, the data is clear. But the consultation is almost always framed around the immediate and expected. You're told about the common, short-term issues, the ones they anticipate you'll ask about, the ones that usually fade. It's a filtered conversation designed for quick acceptance and adherence. It's the path of least resistance to get you started on the medication. But what about the side effects that don't show up in a week? The ones that can silently build over years, impacting your brain, your energy levels, and fundamentally robbing your body of a nutrient so critical that its deficiency is linked to permanent nerve damage? Today, we're pulling back the curtain on the 10 metformin side effects they are praying you don't discover. Please note, this video is for informational purposes only and not a substitute for medical advice. All information provided has been carefully verified. Source links are available in the description. Let's get started with side effect 1, lactic acidosis. Lactic acidosis represents metformin's most dangerous potential side effect, though fortunately it remains relatively rare in clinical practice. This condition, known as metformin-associated lactic acidosis or MALA, occurs when lactic acid accumulates in your bloodstream faster than your body can eliminate it. The resulting acidification of your blood can rapidly progress to organ failure and death without immediate medical intervention. A comprehensive UK population-based study revealed alarming statistics about this complication. Metformin users faced a 4.5-fold greater incidence of lactic acidosis compared to non-users. The absolute numbers translate to 45.7 cases per 100,000 patient years versus 11.8 cases in the control group. Multiple research studies report varying incidence rates depending on patient populations and risk factors. Clinical investigations document anywhere from 2.4 to 39 cases per 100,000 patient years across different study populations. Patients with kidney disease, liver dysfunction, or heart failure face substantially higher risks because their bodies cannot effectively clear lactic acid. Early warning signs include rapid breathing, muscle pain, stomach discomfort, and unusual fatigue. These symptoms can progress quickly to confusion, severe weakness, and loss of consciousness. The condition requires immediate emergency treatment with intravenous fluids, bicarbonate, and sometimes dialysis to remove excess acid from your blood. Metformin triggers lactic acidosis by inhibiting mitochondrial respiratory chain complex I in your cells. This interference disrupts normal cellular energy production, forcing your cells to rely on anaerobic metabolism. The anaerobic process produces lactic acid as a byproduct, overwhelming your body's natural acid buffering systems when kidney or liver function is compromised. 2. Metallic taste, dysgeusia. The persistent metallic taste in your mouth while taking metformin isn't just an annoying side effect. It's actually metformin itself that you're tasting. This phenomenon, medically termed dysgeusia, occurs because metformin actively concentrates in your saliva through specialized transport proteins. Clinical studies document this taste disturbance as a frequent complaint among metformin users. Groundbreaking research published in the Journal of Biological Chemistry identified the exact mechanism behind this taste disturbance. The study demonstrated that OCT3, or organic cation transporter 3, is highly expressed in your salivary glands and actively pumps metformin from your bloodstream into saliva. This transport process concentrates metformin in your mouth, creating the characteristic metallic taste sensation. The intensity of the metallic taste often correlates with your metformin dose and timing according to patient-reported outcome studies. Many patients report the taste being strongest within hours of taking their medication. The sensation typically persists throughout the day, but may fluctuate based on saliva production and oral hygiene practices. Some patients describe the taste as similar to sucking on coins or having a mouthful of aluminum foil. This unpleasant sensation can interfere with eating, making food taste different or less appealing. The taste disturbance may contribute to the appetite suppression and weight loss effects commonly seen with metformin therapy. The OCT3 transporters work continuously to move metformin into your saliva, which explains why the metallic taste persists even between doses. Your salivary glands essentially become reservoirs for metformin, slowly releasing the medication into your mouth throughout the day. This mechanism also explains why the taste often intensifies when you're dehydrated or produce less saliva. 3. Skin reactions. Metformin can trigger various skin reactions ranging from mild rashes to severe, life-threatening conditions requiring immediate medical attention. Adverse drug reaction monitoring studies document these dermatological side effects affecting approximately 4.95% of metformin users. Multiple case reports and clinical series have documented the full spectrum of metformin-induced skin manifestations. Common skin reactions include urticaria, also known as hives, which appear as raised, itchy welts on your skin. These red or pink bumps can vary in size and shape, often changing location as they disappear from one area and appear in another. Clinical studies describe the itching associated with urticaria as intense and potentially sleep-disrupting. More serious skin reactions documented in case reports include leukocytoclastic vasculitis, a condition where small blood vessels in your skin become inflamed and damaged. Research publications describe this reaction typically manifesting as purple or red spots on your lower legs and feet. Case series report that the spots may be painful and can progress to open sores if the inflammation becomes severe. DRESS syndrome, or drug reaction with eosinophilia and systemic symptoms, represents the most severe skin reaction to metformin. This potentially fatal condition involves widespread rash, fever, swollen lymph nodes, and organ involvement. DRESS syndrome typically develops 2 to 8 weeks after starting metformin and requires immediate discontinuation of the medication. 4. Vitamin B12 deficiency. Long-term metformin use significantly increases your risk of developing vitamin B12 deficiency, a condition that can have serious neurological and hematological consequences. Multiple clinical studies demonstrate this association, with the relationship being so strong that many experts recommend routine monitoring for all long-term users. This deficiency develops gradually over months to years, often going unnoticed until symptoms become severe. A comprehensive nested case control study revealed striking dose-dependent effects on B12 levels. Each 1 gram daily increase in metformin dose more than doubled your risk of developing B12 deficiency. The adjusted odds ratio reached 2.88, with a confidence interval of 2.15 to 3.87, demonstrating a clear causal relationship. The landmark diabetes prevention program tracked participants over several years and found a 13% increased risk of B12 deficiency for each year of metformin use. This cumulative effect means that patients taking metformin for 5 years face substantially higher risks than those on shorter treatment courses. Multiple research studies report prevalence rates ranging from 6% to 50% in metformin-treated patients. Early symptoms of B12 deficiency include fatigue, weakness, and difficulty concentrating. As the deficiency progresses, you may experience numbness and tingling in your hands and feet, balance problems, and memory difficulties. Severe deficiency can lead to irreversible nerve damage and a type of anemia called megaloblastic anemia. Metformin disrupts vitamin B12 absorption in your ileum, the final section of your small intestine where B12 absorption occurs. This interference prevents your body from absorbing adequate amounts of B12 from food sources gradually. 5. Gastrointestinal effects. Metformin's most notorious side effects target your digestive system, affecting nearly 1 in 3 patients who start this medication. Multiple systematic reviews consistently document gastrointestinal symptoms as the most common adverse reactions to metformin therapy. The gastrointestinal symptoms include abdominal pain, diarrhea, nausea, and vomiting that can significantly impact your daily life. Research from the landmark diabetes prevention program revealed striking statistics about these digestive issues. 28% of metformin users experienced gastrointestinal symptoms compared to only 16% in the placebo group. This substantial difference demonstrates that metformin directly triggers these uncomfortable reactions in your body. Diarrhea stands out as the most problematic symptom, affecting approximately 16.6% of newly diagnosed type 2 diabetes patients according to clinical studies. This frequent bowel movement pattern can lead to dehydration and electrolyte imbalances if not addressed promptly. The underlying mechanism involves metformin's profound impact on your gut microbiome and bile acid metabolism. Additionally, the medication alters the bacterial composition in your gut, disrupting the delicate balance that maintains normal digestion. These microbial changes trigger increased GLP-1 secretion, a hormone that regulates blood sugar but also affects gastric emptying. The slower stomach emptying combined with altered bile acids creates the perfect storm for digestive distress. Your body essentially struggles to process food normally while adapting to metformin's metabolic effects. 6. Weight loss. Weight loss represents one of metformin's most welcomed side effects for many patients, though the mechanism extends far beyond simple appetite suppression. Clinical trials consistently demonstrate this effect across different patient populations, with the weight reduction persisting long-term with continued use. The weight reduction can be substantial, particularly in patients who maintain good adherence to their medication regimen. Data from the landmark diabetes prevention program showed impressive weight loss results in metformin users. Participants experienced an average 2.1 kilogram weight loss compared to placebo users. Highly adherent patients achieved even better results, showing a 3.5% reduction in body mass over 2 years of treatment. A comprehensive meta-analysis examining weight effects across multiple clinical studies found that metformin reduced BMI by 1.3 units in obese patients. This reduction translates to approximately 8 to 12 pounds of weight loss for most adults. Clinical research demonstrates that the weight loss effect appears to be dose-dependent, with higher doses producing more significant weight reduction. Weight loss occurs through multiple interconnected pathways in your body. Metformin enhances insulin sensitivity, allowing your cells to use glucose more efficiently and reducing fat storage. The medication also affects your appetite control centers in the brain, leading to reduced food intake and fewer cravings for high-calorie foods. 7. Hypoglycemia. While hypoglycemia is uncommon with therapeutic metformin doses, clinical research demonstrates it can occur and may be severe in certain circumstances. This potentially dangerous condition involves blood sugar levels dropping below normal ranges, typically below 70 milligrams per deciliter. Understanding the signs and risk factors for metformin-induced hypoglycemia is crucial for safe medication use. A large epidemiological study examining over 4,000 metformin exposure cases found hypoglycemia in 112 cases, representing 2.8% of exposures. Most cases occurred in overdose situations, but clinical case reports document some patients experiencing low blood sugar with normal therapeutic doses. The risk appears highest in patients with kidney disease, liver dysfunction, or those taking multiple diabetes medications. Multiple case reports published in medical journals document severe hypoglycemia following metformin overdose, even in patients not taking sulfonylureas or insulin. These clinical cases demonstrate that metformin alone can cause dangerous drops in blood sugar when taken in excessive amounts. Case series report that the hypoglycemia can persist for hours and may require intravenous glucose administration to correct. Early warning signs of hypoglycemia include shakiness, sweating, rapid heartbeat, and hunger. As blood sugar continues to drop, you may experience confusion, difficulty speaking, blurred vision, and loss of coordination. Severe hypoglycemia can progress to seizures, loss of consciousness, and potentially death without prompt treatment. 8. Hair loss and changes. Hair loss associated with metformin use is rare, but documented in medical literature, affecting patients in unexpected ways. This side effect, medically termed alopecia, can manifest as diffuse thinning or patchy hair loss affecting various areas of your scalp. Clinical research reveals the relationship between metformin and hair changes remains complex, with some studies suggesting the medication may actually promote hair regrowth in certain conditions. A notable case report published in dermatology journals described acute alopecia in a 36-year-old woman with polycystic ovary syndrome taking metformin. The patient experienced significant hair loss within months of starting treatment, which reversed after discontinuing the medication. This case study demonstrates the potential for metformin to trigger hair loss even in patients taking the medication for appropriate medical reasons. Interestingly, contradictory evidence from research studies suggests metformin may promote hair regrowth in specific conditions. Clinical investigations examining central centrifugal cicatricial alopecia, a form of scarring hair loss, found that metformin treatment helped stimulate hair regrowth in some patients. This paradoxical effect highlights the complex relationship between metformin and hair follicle health documented in dermatological research. The timing of hair loss typically occurs within the first few months of starting metformin treatment. Patients may notice increased hair shedding during washing or brushing, gradual thinning of hair density, or the development of bald patches. 9. Anemia and hematologic effects. Metformin use significantly increases your risk of developing anemia, a condition characterized by insufficient healthy red blood cells to carry adequate oxygen throughout your body. This hematologic effect occurs early in treatment and appears to be independent of vitamin B12 deficiency. The anemia can cause fatigue, weakness, and reduced exercise tolerance that may impact your quality of life. The ADOPT trial revealed concerning statistics about metformin-related anemia risk. Patients taking metformin showed an odds ratio of 1.93 for developing anemia compared to those taking sulfonylureas. This nearly doubled risk demonstrates a clear association between metformin use and reduced red blood cell levels. The UK prospective diabetes study provided even more striking evidence of metformin's hematologic effects. Researchers found an odds ratio of 3.4 for anemia with metformin compared to diet alone. Each 1 gram daily dose of metformin was associated with a 2% higher annual risk of developing anemia. The anemia typically develops within the first year of metformin treatment, making it an early rather than late side effect. 10. Acute pancreatitis. Metformin-induced pancreatitis represents a rare but serious complication that can occur even with therapeutic doses in patients with normal kidney function. This inflammatory condition affects your pancreas, the organ responsible for producing digestive enzymes and insulin. The inflammation can range from mild discomfort to life-threatening complications requiring intensive medical care. Multiple case reports documented in systematic reviews establish a probable relationship between metformin and acute pancreatitis. The Naranjo causality assessment, a standardized tool for evaluating drug-related adverse events, suggested a probable causal relationship in reported cases. These cases often involve recurrent episodes that follow a predictable pattern. The characteristic pattern of metformin-induced pancreatitis involves symptoms that resolve completely when metformin is discontinued. When patients unknowingly restart the medication, the pancreatitis returns, often with similar severity and timing. This rechallenge phenomenon strongly suggests metformin as the causative agent rather than coincidental occurrence. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.